Name's Kelsey Chris. I'm in Jefferson City, Missouri, and I was supposed to be on here. I asked to be on here 3 weeks ago to share my maternity experience because when I joined Impact 3 years ago, about 3 years ago, um, I had a couple questions like, how does it work with maternity? How does it work with this and this? All the questions when you first join. And but I've lived it. I've lived it for 3 years now. And so I say, Melissa, how do I share this with other people? And if I would have been on here 3 weeks ago, very pregnant, I was just going to share my maternity experience. But now that I'm here with a 3 week old baby, I'm going to share my bills that have come in from labor and delivery, which has overperformed, Impact has. So there's just a confidence of the experience. And what I want to tell you guys, I was going to share the maternity bills. I have a really good bill from a little over a year ago that I'll tell you about. And then just tips to be confident because the first year of me being with Impact, I didn't feel very confident, right? I was just kind of scared. Does this work? Is this too good to be true? Is anyone going to accept me? All those feelings and that you have about any big decision. And just that I've got to live it, I really want to tell it. And I want you to know that this works. And you do have to stand your ground sometimes. You do have to be confident in who you're talking to in the healthcare world. But I want to give you that confidence because I didn't have it at first. And ever since I have had it, it all works out. They actually figure it out every time. Like, oh no, here's my EID, pay your ID number. Oh no, here's the number you can call to get clarity from Impact. And just kind of standing there and keep reminding them that there's ways. And it worked out every time. So, Melissa, I'm going to show my first bill of Gabriel here, was born 3 weeks ago. And here in a moment, I'm going to brag on the wellness rewards because here was our first bill from the hospital. It was $5,500 over. And then it got, we had our members' savings, which is the repricing part of it. And then because we had met our PRA, our deductible, we had met that 15 days before I had him. Very strategically, we met that 15 days before I had him. And therefore, it got approved for sharing. You guys can see that number over $2,000. So ultimately, I owe $303, which I actually just paid yesterday. So within 3 weeks of having him. So that was one of our labor and delivery bills with Impact. And then I have one more that I was going to show you. This was the big one, right? Like the question, how much does it cost to have a baby? These were our two big bills. And of course there's other smaller ones, but so we got billed over $12,000, and then that's the repricing, right? But beneath it. And then because we'd met our PRA, it got shared through the community, as you can see. Ultimately, I owe a little over $800 for that $12,000 bill for having Gabriel in the hospital. So, and I just want to brag on with, as you see those numbers, and I'm probably going to end up paying like $1,000, $1,500, maybe 2,000 to have a baby with Impact. Now that is pretty special because we seriously utilize the wellness rewards every month. I'm very diligent about that. We have a gym membership and massage therapy. Well, we do all the list of things that you can turn in receipts for, but I turn in the $150 per month. And I've been doing that. I do it every month of the year. And then just with my maternity bills, because you get those bills. We met our PRA because we chose the 2,500 for our family of five. We pay $605 a month for our family of five. Prior to Impact with United, we were paying over about $1,200 for three of us. We've had more babies since. I joke my husband that it's the same price, three or more for a family, so we can have 10 babies now. And our healthcare doesn't go up because of it. So those are the bills that I wanted to share. I also want to tell you that 2 summers ago, I had to go to the ER on the 4th of July. We'll not forget that. Went to the ER. I ended up spending overnight there to get an IV. And I got that bill the next day, and it was $10,000. We had not met any PRAs. I just got a $10,000 bill because I stayed the night in the hospital with a drip. And once it got repriced, we ended up owing about 2,400. So we paid that, and guess who met their PRA almost immediately? So the rest of that year, we were pretty well taken care of again. So that's just me bragging on the bills. I think what I want to say about Impact is the pricing is beautiful, but there's just this back end that you almost have to experience. Like With Impact, what the doctor says goes. We've been with prior insurances where what the doctor says, and then they're like, well, you got to go through 3 weeks of this therapy and you got to get an x-ray and this to get what you need. Like that's happened to us. And I'm like, wait, what? No, we just need this. But with Impact, they don't, I mean, there's certain protocols you have to do before like big surgeries, but what the doctor says goes. That's a big deal. When my husband and I joined Impact, we were self-employed. We needed something. We started looking. We went down the rabbit hole. We found Impact. We're so thankful. Since then, about a year ago, I got another job that offers amazing health, all kinds of benefits, right? And we just put them side by side and looked through it all. And because I know what I know about Impact, we chose to stay with Impact over these amazing benefits that are offered by this huge company that are good. And we would have saved about $50 a month if we would have went with the company's benefits versus Impact. But I know the difference of that $50 a month. So we chose Impact. And literally, once we chose that, it was 2 months later that Anthem went out of network for our local hospital. And people were freaking out. They lost their doctors. They lost their out of in network. Now they had to move to another place. And the whole time I'm like, this doesn't even matter to me. I can still go wherever I want to go. And it was a fiasco that I didn't have to be a part of because we chose Impact. So I think that's all I wanted to share. I love the wellness rewards. We're just a family that only goes to the doctor when we're sick. And so we just never plan on meeting our PRA deductible. We just don't plan on it. But um, them encouraging us in our healthy lifestyles really helped out with this birth. So, Melissa, I think that's all I had to share for today. I just want you guys to be confident and stand your ground. We joined 3 years ago when I thought it was still pretty new. I felt like pioneer woman in our location because no one had heard of it. And guess what? Now everyone has. And I'm going to say every facility I've been to, they all bill Impact beautifully. So we're just onward. Thank you, Melissa.